for today. I would like to ask, how many of us know our topic for today? Our topic for today. If you know our topic for today, can you quickly put it in the chat box if you know our topic for today? Quickly, please. It doesn't seem like anybody wants to answer me. Please, I like an interactive session. It's going to be interactive. We're going to talk and learn and discuss. It's not meeting presentation. So we are here. Yes, thank you, Mr. Olani. Meditation and medication, managing the psychological strain of chronic physical illness. Thank you so much. Yes, a lot of people know our topic. Thank you. So because you know the topic, I'd like to believe that you are sort of prepared, or you have some form of understanding of what we'll be discussing today. Right. So you're not expecting to hear about stroke today. What was stroke here? Probably. You're not expecting to hear about something that is not tailored around this topic. So today we are going to be talking about how to manage the psychological strain of chronic illness, chronic physical illnesses. I'm sure we all know what chronic illness is. Right. So examples of the chronic illness that we have are the diabetes, the hypertension, even if it's a broken bone and then you're purchased for a long time, or something that lasts probably more than a year, or something that you have to manage or treat for a lifetime. Those are examples of chronic illness. And we know that having a medical condition or a disease that you have to manage for a lifetime, or that you have to manage for a very long period, can put some effect or have some effect on your family members, on yourself, and on everyone around you. So I would like to, that is why. Can we hear me? Can we hear me clearly?
Yeah, I can hear you.
Yes, we can.
Yes, we can hear you.
Thank you. Is my video stable? Because I feel like it's
yes, not stable.
It's not stable. Okay, I don't know why that is happening. So I will work on that while the discussion goes on. But please manage my going in and out face. But I'm sure you can hear me, and that's the most important thing at the end of the day. Right. So, like I was saying, we all have contact with some form of chronic illnesses, right? Here or there, whether it be family members or you yourself. And it has come to our attention that a lot of times there's a lot of psychological strain on you, and we feel that it's very important that we discuss that today. So I have with me Doctor, one of the best in the game. If I start reading his profile now, we will not leave here. He's very experienced. He has all the knowledge that we need for this presentation. So be rest assured, whatever questions you think you may have, be rest assured that you're in the best hands and you get all the responses that you need. But because of time, and I don't want us to I want us to have enough time to discuss this thing to the basis, right? So I would like to introduce Dr. Shola Olorokere. He is a wonderful person, and he's going to ensure that this session is great. He's the best person to handle this session. He's a psychologist, right? And all that. So without further ado, I would like to see some show of hands again and some round of applauses as we welcome Dr. Shola into the buildings, as we appreciate him for taking his time out to be here today. So can we have some show of hands, some interactions, please, from the audience? Yeah, thank you. I'm not seeing any interaction. Should we tell Dr. Shola to be going? Because it doesn't seem like the people in this building want him to be here. So I would like to see you in the chats, some claps, some hello, some welcome, some hi, anything, people? Nobody's saying anything. Dr. Shola, it seems like we might have to, take this session, maybe end this session, because I don't think our audience is happy to see you. Please, can we show Dr. Shola we're happy to see you?
Yeah, there are lots of reaction here. There are lots of reactions.
So serious.
I can see.
We are happy to meet you, sir.
Thank you.
Very happy to meet Dr. Shola.
Thank you.
Sir.
Dr. Shola, we are happy to meet you. Just go ahead. The woman talking knows that a lot of children are on the platform. So just go ahead. We are going to listen to our father today.
Yes, sir. Yes, sir. All right.
You.
Like I've already defined what chronic physical illness is, and I would like to bring Dr. Shola to the forefront of this presentation right now to discuss the psychological strain of chronic physical illness. Dr. Shola, are you with us? I currently can't see you. Hello, sir. Can you hear us now? Dr. Shola, are you there?
Can see Dr. Shola. It's just that we can't hear him.
Okay, Dr. Shola, we can't
hear you. I think it's your headset or so.
Can you hear now?
Yes, we can hear you.
We can hear you, sir.
Okay, cool. Let's remove the headset. All right, good afternoon, everyone. Good afternoon. It's a pleasure to be here.
Good afternoon, doctor.
Yeah, it's a pleasure to be here. And first of all, I want to thank my colleagues and I want to thank my colleagues at Leadway
to please mute their mics at this time because the session is well underway and we don't want to get distracted. Thank you. Sir, please go ahead.
Okay, thank you very much. So I firstly want to thank my colleagues at Leadway Health and for putting together this session. It is very, very important, and I believe that it will be very helpful for us that has attended today, that we will all benefit and gain one thing or the other this afternoon. Just as a start, I wasn't upset when people were not showing their hands that they were here, or when people were not putting the emojis in the box. I was not angry. I know there's a lot of people. I know there's a lot of things that people are worrying about at this current time of the year. They're thinking about petrol. They're thinking about electricity. They're thinking about security. There are so many things going through people's mind, and I genuinely understand that. And we're all together in this struggle. To the topic of the day, yes, I think it's a very fantastic topic that we've put together to share, to discuss how long-term physical illness can impact our mental and emotional well-being. And thank you very much. This is a very, very good audience. People came on time, and I promise that we will be sharing a lot of knowledge this afternoon. I'll be here to answer your questions. I have extensive experience in this field, and I'm optimistic that it will be a good conversation all in all. As a psychiatrist, it's always good for us to have a bit of a guide in terms of some slide that will guide our conversation. So I've put together a slide that I'll be sharing. Can you confirm you can see my slides?
Yes, we can see.
Okay, so
yes, we can.
Great. So it's just going to be a guide for our conversation, and we've put together this exciting topic: meditation and medication, managing the psychological strain of chronic physical illness. As we grow older, and as we face the challenges that comes with day-to-day living, developing one illness or the other becomes an inevitable thing. We all know the various preventive measures that we need to follow in life not to develop this illness, but there are so many factors. Some we can control, some we cannot control. Some people have ended up having chronic illnesses due to their genetic makeup. It's not of any fault of theirs. It's not because they've done something wrong, but it's just the way they've been created. So this afternoon, we're going to be looking at how long-term illnesses impact on our mental health, and most importantly, our well-being on a day-to-day basis. It's important we start from a place that we understand what chronic physical illnesses are. These are long-term lasting conditions. They can be mainly managed, but unfortunately, they can be cured. But trust me, we have a lot of scientists in the labs that are working hard, doing a lot of research, trying to find long-lasting cure to all these things. But start up today, what we term chronic physical illness, typically they don't have cures. The heart diseases, the diabetes, the arthritis, and so many other conditions that it's common amongst us nowadays. This illness has profound impact on mental health, leading to loads of things: depression, anxiety, stress among patients. And statistics shows that about 30% of people who have chronic illnesses do sometimes come up with symptoms of depression or anxiety, because this has a overall impact on their day-to-day living. And this next slide I'm going to show, it typifies what we're going to discuss this afternoon. You're going to see on this page that we have, on the left, you see what a cycle of what shows what chronic pain cycle looks like. And as I was putting together this presentation, I thought about it that a lot of people would think it's only people who are old or elderly that this presentation is relevant to. But trust me, children, unfortunately, sometimes do have chronic physical illnesses as well. And if you think about it, what has the child done? You know, for if someone is diabetic, you might want to question their diet. If someone is I've got cardiac issue, you want to say probably they've not exercised well in their lifetime. But when you talk about kids, what would you say? Unfortunately, some of them have been born with this condition. You know, some of them have got cancers, some of them have got, unfortunately, got asthma. This also falls under chronic long-term disabilities and physical illnesses. As you can see, 1 in 5 children live with chronic illnesses. That is astonishing, and it is so sad that right from a young age, they would have to cope with all these things. They will not be able to join in games, in things that their friends are doing. They might not be able to have the same diet right from a very young age. And this will persist up until adulthood, unless our clinicians in the lab comes up with something significant and they are able to find cure to these long-term conditions. So for those kids, you know, the focus will now change a bit from being able to function up to their optimal level to actually initially surviving, to say, wow, let them just survive this bit. Let them just be able to thrive. It is a big challenge for most especially the young person and also their family as a whole. But I know that a lot of us from this call, if not all, we're all adults. So I would shift the focus to the left-hand side of the slide you're looking at, and to adults. So one thing that seems to be common in a lot of long-term physical illness could be some form of pain. So where pain is here, you can just replace that with long-term physical illness. And this picture is what circles around someone that has got a long-term physical condition. We're all different from one person to the other. We all have different beliefs culturally, and in terms of faith, and in terms of the support structure you have around you. All these factors will affect which of this part of this diagram applies to you. So I'm not saying that everybody that has physical illness, chronic physical illness, has to have all this, but this is just a guide. So, for example, if someone has got arthritis, what would they do? They would avoid physical activity. There'll be a lot of lethargy. You know, there might be a lot of loss of muscle strength and overall fitness. They're worried if you've got cardiac problems. You know, you're worried, you're tired. Sometimes you might not be able to sleep. There may be overwhelming feeling of anxiety, fear. What's going to happen next? You know, recently there's been a lot of shortage of medication in the country. The impact is going to have on my finance. You know, there was a time that there was a lot of epidemic of fake drugs, but we thank God we're all associated with Leadway. They are assuring that we're getting the best quality of care. So that is very, very important in all this as well. So the uncertainty that sometimes comes with this illness, the realization of things that you might not be able to do again, you know, the realization of some food that you probably love to beat that you might not really be able to eat. You know, when you talk about diabetes, cardiac issues, they now start telling you about portions, sugars and things like that. And some people might have been even social drinkers that like alcohol, and now they are battling this long-term physical condition and they are not able to drink again. And you might think that is something silly to say, but trust me, you shouldn't underestimate the fact that you're going to stop someone from accessing what they previously enjoyed, even in the best interest of their health. And then in the midway, just is on the left side of the leg of this diagram, you see the side effects of medication. That is another big thing that do affect how people feel. The fact that you're taking, the medications are chemical, they're there to help you. And most times when you pick up medication and you look at the leaflets, they're going to say 1,001 side effects. Typically, not everybody will experience those side effects, but what is telling us that there's a possibility this could happen. This alone brings fear. And sometimes you're reading the side effect, it might not happen to you, but the fact that that potential is there keeps you on the edge. And this is when clinicians think about weighing the pros versus the cons to say, wow, you're probably going to get a better quality of life with using this medication rather than not using it. And then we go for the better option. And some of these side effects of this medication could be weight loss or weight gain. You know, there is a lot of impact that this has on your emotional and mental well-being. The fact that you might not be able to do your job again, especially if your job has been one that has involved physical activity or has required you to attain a level of physical health stability. Unfortunately, you might not be able to do that. I've seen people who suffer from chronic back pain and initially required a lot of adjustments to work posture, but sometimes how long will they be able to do this for? The adjustment you need to put in place to be able to continue to do your day-to-day living. The fact that sometimes this long-term physical illness can then lead you to requiring a lot of support from people. You are now dependent on people for even your activities of. I think we have some interference there.
Good
The
afternoon.
fact that
Please, can you please mute your mic if you are not Dr. Shola?
I think from my experience, the one that really impacted, two that really impact on people so much, the fact that you might require assistance from people to do your activities of daily living. I once saw a young chap who was unfortunately attacked by a group of thugs, and he was stabbed at the back, and it's affected his spine. So he cannot. This is a very young, fit guy who used to actually be a sprinter, and he had that big injury to the back, and he was describing to me how that changed his life. He had to move back to the family. He used to live on his own. He had to move back home. Apart from moving back home, he now had to rely on his mom helping him with shower and dressing up in the morning. You know, the fact that your whole life you now require support and care. So this impacts on someone's mental health. And this is what sometimes tips people into depression, mood swings. And let's talk about depression for a minute and how this can affect you. How long-term illnesses could make people sometimes depressed. And I will refer to what the gold standard diagnosis of depression means. Depression means persistent low mood, lasting for 7 out of every 10 days on the average, associated with feeling of hopelessness, feeling life is not worth living, feeling like you're better off not in this world because you're dependent on people, lack of interest in things you were able to do before. So if you look at the case scenario of this young man who was previously fit and able to do things until he suffered this injury that has resulted in chronic back pain and is not able to do things, he's not able to go running or play football like he used to, gradually losing interest, feeling hopeless that this would never get better, feeling that I would have to continue rely on people for my day-to-day living. Then he starts isolating himself. He cuts off his friends. He doesn't want people to start seeing him in that condition. Gradually, if the appropriate support and structure is not there, unfortunately, this individual might fall into depression. Impact on relationship and isolation. And that's a very big one again that I've seen in my experience, especially for people who have cardiac problems and hypertension and all. Some of this medication might have long-term impacts on our kidneys and sometimes even our sexual health functioning, our performance in the other room, and this could break relationships. I was delivering this kind of webinar somewhere, and one of the participants had come to say that his friend used to be on an antihypertensive medication, and he realized that the medication was beginning to affect his sexual functioning, and the partner was complaining. The partner was not aware of his diagnosis of hypertension and the medication he's been taking. So this man just stopped the medication without consulting the doctor, just because he wanted to save the relationship. And unfortunately, after stopping the medication, he wasn't monitoring his blood pressure went out of the roof, and unfortunately suffered a cardiac arrest. So what is the moral of that story? One, if you're on any long-term medication, do not stop it unless your doctor says so. If you have concerns about side effects, rather than unilaterally taking a decision, speak to your doctor. If you think it's impacting on other functions of your life, there are solutions. There are ways where things could be managed rather than you just stopping medication. But we'll get to it. And also, I've not lost sight of the topic for today is meditation and medication. Meditation is one of the ways we could cope. And I selected it because it just rhymes with medication, and I just wanted to give it a rhythmic flow. So we're going to get to meditation at some point, meditation at some point. But it's important that we highlight how these chronic illnesses could affect our mental health, because it's only when we know how it's affecting us that is when we can get the appropriate help that is needed, or that you can utilize the appropriate coping strategies that we're going to talk about this afternoon to manage these difficulties. So anxiety is another big one. You're worried because sometimes this illness requires time to time checking in and checking out from hospital. You don't know what are they going to see tomorrow. Oh, is this count high? Is this my HB1AC? Is it under control now? Is the diabetes well controlled? There's so many unanswered questions. So talking about that could lead to anxiety. And when I talk about anxiety, I talk about what do you do about things that you cannot physically control. You need to understand that some things we cannot control. And when we can't control things, ongoing worry about it would cause us more problem. Like some of the things that we've explained earlier, it could lead to loss of self-esteem, fear of the future, especially when you're not able to actively get any form of income. Again, problem with finance and unemployment is just a lot. I'll go to the next slide because it looks like this slide is just a very, very sad one. But it's important that we highlight and summarize that the psychological strain of chronic physical illness can manifest as feelings of hopelessness, frustration. That's where you hear people saying, why me? I haven't done anything wrong. You've seen people who have ended up with long-term respiratory breathing problems and they've never smoked. They've never done anything that could have predisposed them to it, but the only explanation could be due to their genetic makeup. It could lead to isolation. Managing this strain is crucial for overall well-being and quality of life. And that is what I said, that what do you do when things are out of your control? You have to resort to managing it and making sure that we are still, despite our situation, we're still able to live life to our maximum full potential. Medication can play a vital role in alleviating these symptoms and improving someone's overall mental health. So What I'm saying is that if you find yourself that, well, things have gone so far, this has affected you so much. Yes, there are options of medications to help with your mental health. But as a psychiatrist, medication is not always the first thing. It's not always the first thing to run to. There are a lot of options around how we will we can manage our mental and emotional well-being. Before we go to coping strategies, I just want to open it up for people to comment in the box to say, in terms of the previous slide we've shared, which one of these feelings or psychological impact of chronic physical are you able to relate with, or that can you identify with, or have you possibly experiencing? So if you can just put something in the box, or if someone or two people want to speak, I'm happy to take that, because it's important that I hear from one or two people who might have experienced this or know someone who is experiencing this psychological strain. Do we have anything in the book?
Do we have anyone that wants to share? We'd like to hear actual opinions, or if you want to share it in the chat, we also appreciate that.
I think we have two hands up. We have three.
We have Miss Kundayo. All right, Mr. Kundayo, your hands are up. Would you like to share with us? If Mr. Kundayo is not there, I'm seeing Beatrice's hands up. Would you like to share with us? Or simply put it in the chat box. Dr. Oshola, I'm not sure
Can you hear
if
me?
you can get a response. Yes, we can hear you. Please go ahead.
Okay. For me, as much as one wants to try to downplay what's going on in the country right now, you can't help but feel. I don't want to use the word frustration right now. I don't want to use the word frustration right now, because you see the way the country is going. You're wondering, okay, where is this going to? Where is this leading to? How am I being affected by this? One way or the other, it puts a kind of stress, like a strain on you. And you're wondering that, okay, I've earned a salary. What ordinarily I would have bought like 3 months ago, the quantity of what I would have bought like 3 months ago, today, I'm getting lesser for a higher amount. And the whole thing is somehow, so I try to not to dwell too much on it, but truth be told, it's really not funny right now. Thank you.
Thank you for that response, Ma. I think we want to get one more opinion. Miss Oninoye.
Yes, yeah. Good afternoon.
Good afternoon.
See, it has to do with the colleagues of mine that had salivary gland cancer, and the consultant, for me, I look at it as a foolish something, because consultant, in the midst of everybody, when the result came in, just told the guy in the midst of almost about 130 people, Mr. Man, you have a cancer of the or something like that. That guy never get out of that depression. The guy died. And for me, at the time I had to write letter to the commissioner of health in Lagos, because I felt it so much, because I was there when that incident happened. It's proper for a doctor, a consultant at that level, break under that kind of a news. If that person is going to, doesn't have any chance of living, you break it in the midst of a lot of people. Where is the human empathy? Where is the sympathy? Where is the counseling session before you break that kind of a news? Some people, when they hear cancer, they feel that person doesn't have any have a 0% of survival. But there are people who have pushed through and they are doing very well. But at the same time, when you are breaking that kind of a news, so some people who doesn't have that opportunity of scientific breakthrough and things like that, they will only think of death and nothing again. And you can't get them back recovery. And once your body shuts down, everything begins to go wrong with your body. But when you're not positive about your body healing itself, you go. Up to tomorrow, I have that kind of phobia for especially lashes. The way
Please,
they
if you're not,
handle and the way they handle. Are you hearing me? The way they
we can hear.
handle diagnosis and the way they break news to people, I think is off me. I don't really like it. And it affected a lot of people and made people to just lose hope. This is not the first time, this is not the second time. I don't know. I don't really understand. Does it have to do with doctor or because they just lack sympathy for people or because they have seen so much death that they don't have feeling again?
Thank you so much, sir. We thank you
Okay,
so much, sir.
thank you. Can I respond? Can we continue, or you want to
Yes,
take one more? I think we've taken two. That's fine.
I think that's taking a bit of time. So Doctor,
Yeah.
can respond, please, sir.
Okay, thank you very much. For the First Lady, I share your views absolutely. And that was what I said at the beginning of this conversation, is to acknowledge that things are tough generally. There's no sugarcoating it. It is everywhere. It's eating both high hand of those who are rich and those who are poor, everybody all around. And yes, you said you didn't want to use the word frustration, but trust me, I'm as frustrated as you. And it's important that we all even identify and label the way we feel. If we are frustrated about something, there's no harm in saying it. We're frustrated about it. If we are angry about the situation, we're angry about it. That is the way it is. But again, it comes back to understanding that some of these things, it's out of our control. And ongoing anxiety and all what will they achieve and worrying is about first, probably a better bit of planning, a better bit of seeing where we can cost save things or move things around and just hope for the best. It is something that cuts across board, but talking about it and seeing how people are coping better, how they're managing, and see if there are other things we could share and learn from each other. The second question and comment. This is a very, very big issue that is something that has really been at the forefront of my mind. But first of all, I want to say for my Leadway colleagues that Leadway, you're able to get second opinion if one has gotten a diagnosis of a long-term condition. There's an option for you to say, oh, can I get a second opinion around this, so that you're sure. And in Nigeria, we're trying to get people, even our colleagues, our doctor colleagues, to do things right, to do things the right way. There's something called breaking bad news. It is so inappropriate for you to break that kind of news to someone in the midst of 3 people, not even 30 people. There are proper protocol and process that needs to be followed. And I'll give you an example. If I was to be the one delivering that news, if I've seen this is the result that it looks like cancer, I would ask the person, can you come with someone you trusted, if you're married, a trusted friend, someone that can be with you, just to come and speak to me. And then you take them to a quiet room and explain to them that this is what the investigations has found, and this is what the likely diagnosis could be. And also offer the individual that we can pursue a second opinion, rather than just saying this is the final, this is the final. Every individual has that right to say, can I get an opinion? And also there should be associated counseling to say, how do you support an individual that you have given that sort of bad news? You can't just expect them to walk out of the clinic and continue to live like normal. And you're right, the anxiety and the fear and the worry around that diagnosis sometimes fast track the deaths for some people. they will just be hopeless. They might not even want to, they might not really engage in the treatment, and they are just worrying. I've heard people who on airing that news, unfortunately, they take their own life and say, well, there's no need anyway anymore to even try. And I totally agree with you that you've seen people who have been diagnosed with cancer and they're on medication and they're living normal life. People who have diabetes, who have, I've got their colleagues who function as a doctor, they're diabetic, they're hypertensive. So it does not limit what you're able to perform in any way, but everybody has a chance, has a right to appropriate good, top quality care, and they have to be treated. You know what, in my practice, what I say every day, what I say to my staff and my colleagues, you have to treat everyone with dignity and respect and a lot of empathy. That has to be how you treat people. Yeah, exactly. So that's pre and post counseling. It is absolutely important. So thank you very much. I really appreciate those who have contributed. There'll be a time at the end for us to talk about have some questions and answer. So let's continue. So I'll skip this because these are medications that one can use if you are having if the therapy has not really worked or counseling has not really worked for you. And in terms of therapy, it is the first line if of support. Therapy, there's no harm in having therapy. It does not signify that you are less of a person. If I were to have a long-term condition today, I will readily submit myself to counseling, to speak to someone. That's why they call it talking therapy. You know, sometimes when you talk to someone, it gives you that sense of relief. It helps you offload all the difficulties, all the troubles in your chest. And that is why we have professionals within the Leadway team, and they're established to be able, that you'll be able to talk to that will be able to listen to you in a non-judgmental way and will be able to keep things confidential. That is why you need to seek professional support. Now, medication management strategies. Proper medication management is essential. That individuals are there to prescribe medication when you're suffering from a long-term illness. Do not wake up one day and say, this medication, I'm tired and I'm stopping, because most likely you might be falling into a bigger problem, creating a bigger problem for yourself. It's important that you work closely with your healthcare providers so that the right medication, right dosage, proper opinion, both for physical and emotional well-being, is incorporated into your care. It is very, very important. You know, a lot of research has shown that individuals who have ongoing psychological support when having a long-term physical illness, it increases their chances of survival and also helps to give them better quality of life. They're able to function a bit more. They're able to function a bit happily, even despite their constraints in terms of ability to do things. So I think this is where we need to focus on today. To say, yes, we've been talking about chronic problems. We've been talking about a lot of things that are not right. But let's focus on some things that we can do to support ourselves. So I've put these as strategies of maintaining stable emotional well-being, be it having long-term physical health problem or even the day-to-day difficulties we face as Nigeria can sometimes present as a chronic physical illness, because some of those problems are chronic. Since when have we been talking about corruption? Since when have we been talking about increase and unstable economy and difficulty, insecurity? So these are just general tips. And it will be good that even if you don't have a chronic physical health problem, please listen to these slides or just have a look at it. Mindfulness. Practice being present without judgment, breathing exercises, and meditation. I have a different slide and I'm going to show you about medication. It's just a very short slide. I'll show it after this one. Healthy sleep. Sleep, it is very, very, very important. And I'm sure that some people will say, this man is talking about healthy sleep. When sleep is part of their main chronic problem, but you need to discuss that particular issue with your doctor or your therapist that you're seeing. Sleep is so vital to our ability to be able to maintain a stable mental state. A consistent sleep schedule, creating a bedtime routine. I normally refer to sleep as foundation. It's like the basis of everything. If your sleep is not right, trust me, so many other things will not be right. You have high chances of being very irritable. You just get angry and snap at things that you normally wouldn't snap at. So it is very, very important. If you're having problem with sleep, it's important you speak to a professional now to guide you. And if you were seeing me in a clinic and telling me, oh, due to my back pain, I'm having a lot of sleep.
Due to my back pain, I'm having a lot of sleep. Due to my back pain, I'm having a lot of sleep.
I'm having a lot of feedback from someone. Yeah. So if you're having a form of another person mute themselves, it's important that you understand what part of your sleep is actually the difficult part. Is it the fact that you're struggling to go to sleep, or when you wake up to use the toilet, then you're struggling to?
You're mute.
Okay, I'm muted. Dr. Shola.
Why you're currently
That means someone muted me. Okay.
I'm muted.
Can you hear me now?
Yes, we can hear you.
Yeah, we are hearing you now. Loud and clear.
Okay, so I was talking about sleep in terms of how sleep is so important and vital to a stable and mental well-being. For it's important that you understand and you check your sleep rhythm. Is it a problem going to sleep, or when you wake up, you are not able to get back to sleep? So once you understand that, the professional can then guide you. And it's not all about using sleeping medication. Just tweaking around your bedtime routine and things might just be the solution that you need. Self-care. It's important that in the middle of all these difficulties, suffering from long-term physical, you still need to practice self-compassion. Take break. Try to identify things that you enjoy. You know what they say, wahala no dey finish. So it's important that even in the middle of the wahala and up and down, you need to prioritize your emotional well-being and do intentional things. Take time out, and all those things they don't have to cost a lot. Just try to prioritize give yourself sanity, surround yourself with positive people that will be your biggest cheerleaders and will support you. And when I talk about this again, I always talk about the role important of family, friends, and faith. Those 3 F's are absolutely very, very important. If you are someone of faith, most faith normally preaches about hope. And us holding on to that hope can just be what someone needs. Exercise, if you're able to do so, regular walk, it releases endorphins, it helps you happy, it makes you have a bit of hope. Journaling, I've just recently started doing this, and it's such a fantastic thing to do. Writing down your thoughts, writing down exactly how you feel. It helps so much. It helps you unburden, and it helps you offload. And guess what again? It helps you have some bit of sense of gratitude to say, even despite what I'm going through, I'm still able to do this. And just to touch on gratitude, I've managed a lot of people who've got chronic physical illnesses and has impacted on their mental health. And one of the few tasks I get to give them is for you to write me the things you are grateful for. And sometimes they look at me and say, I've got this long-term condition that might probably result in death at some point, and you're telling me to write things that I'm grateful for. And I'll say, yes, you still need to go and try and think about the things you're grateful for. And they come back, they're able to write a few things. And it just shows that even in very terrible situations, you will still be able to pick out 1 or 2 things. The number one thing I said is that COVID. So many people died during COVID. The fact that you're still here is what being grateful for. So it is journaling and writing down your thoughts. It is always so effective. Seeking therapy or medication when need arises. There is no price for someone who has the biggest shoulder to soldier on. You know, there's nothing like manning up to all these things. We all need to understand that our emotions can sometimes make us vulnerable, and there's no crime in that. So it is very, very important that we seek professional support when we need it. I'm just going to stop this one and share another slide quickly, which is just going to talk about meditation. Okay, because I think it will be good if we do that.
All right.
Can you see me now? Slide now.
Yes, I can see you, sir.
Okay. Okay.
Right.
So meditation is is a very, very important thing, and it helps us be in tune with our emotions. It is so therapeutic. And there are a few types of meditation that can help reduce stress and anxiety level. It helps bring a sense of calmness. And it helps us to identify that even despite all the things we're going through, there are positive and things to look forward to. And there's something about bringing mindfulness to meditation. It so helps us to reinvigorate ourselves and help us to achieve optimal wellness, even in the midst of the difficulties that we are going through. I will share this link to anybody that wants to engage in meditation. It is one of the key things that a lot of research has shown that it helps. It involves just sitting down and focusing on the here and now and breathing in and out. It looks simple, but it has a lot of therapeutic positive effects. We'll go back to the main slide that I was sharing before. Okay, so seeking professional support, that was where we are. It is so important that we seek professional support. At this point, I want to open it up. Dr. Tiago, can we open it up for questions?
Yes, we can
Mindful
open
of
it up.
time.
But before we need up for questions, thank you so much, sir, for the presentation. It's been fabulous. I myself have learned a lot, and I believe everyone in the audience has also learned a lot. But before we go into the questions, I would like to highlight some important points in the things that you have said, just to ensure that the audience remembers these certain things. Please, as we are in the yes, I'm very happy that people are showing a round of applauses to say thank you to Dr. Shola. Please, we'd like to see more of that. Thank you so much. So I think one major thing, or one thing that I noted that Dr. Shola mentioned during the presentation, is being able to identify and label that you actually have, that is actually a psychological response to chronic illness. Most of us are not aware, or most of us do not acknowledge the fact that when something is going and is chronic, you would actually have some risk. Your mental health would be affected, right? And another major thing, so once we can identify and once we can come to realization that this is a problem, or this can be a problem, right? So even before the chronic, the mental health issue comes, even before the psychological strain comes, you can ensure that there's some prevention. You can put some prevention in place. And so because of that, I would like to also highlight one other thing that you mentioned for us not to forget is the fact, the part of journaling. I've actually come across a case where it was a depressed patient, and she had no idea that she was depressed. Everybody was trying to convince her that she was depressed, but it didn't work. And then the key that was required for her to recognize what was going on was when she started journaling. When she started writing down things that were actually going on, that was when that light bulb came for her to understand that this was a problem. And if that realization does not come in terms of mental health issues, there won't be progress in treatment, right? So I have a few questions myself before I open it to the audience. It will be as fast as possible so that every other person can go back to their work. So as a caregiver, because I saw in the slide that you mentioned that children also can have chronic illness, right? And then, this can put a strain on the parents, on the family members, and even on the child itself. Or maybe you have a father, you have a brother, you have a mother that has a chronic illness. As the caregiver, as the support person, how can you identify that this particular person is having psychological strain? And what are the things that you can do to help this person?
Thank you very much. Thank you. First of all, let's give a big shout out to all the caregivers in the house. If you are here looking after someone who is suffering from anything chronic long time, I give you salute, because it is not easy. It is not what? It is not easy. We all have our own personal things we are going through. For you not to take up that responsibility to be looking after someone else, it is a lot. So, well done to you guys. You're doing a fantastic job. Now, how do you identify that the caregiver is going through psychological strain? Irritability is the first one. Things that they normally do with joy and they support the person. Now they want to help the person, and the Yoruba will say "Konra." when they are the things and they're bit nagging and all, and they are tired, they are lethargy. There could be loss of appetite. They're not interested in things that they would normally do before. And sometimes they could be tearful as well to say, when will all this end? How long will I continue to do this for? You get, so those are the kind of symptoms that you see that this is beginning to impact on that person. And how do you support that person? How do you support the person? Is first of all to validate their emotions. Say, you are trying, you are doing well, you are doing a good job. In fact, really appreciate you. Validate their feeling that, yes, acknowledge that what they are going through is valid. It is not easy to be taken after someone every day. So first validate that person. It is not the time for you to now start comparing. Is that what you're doing? If you know the person me I'm taking care of, there's no price for the biggest caregiver. So you need to first validate that person and let them know that they're doing a fantastic job. Give them listening here, show them love. And if there's any way you can even give them a break to say, you've been doing this every day. Let me take over from you for one afternoon so that you can have your own little break as well. It will be a very fantastic gesture. Support them in any way we can. So those are the kind of things that we can put in place to, number one, help identify those signs quickly, and then support the caregiver. But again, a big shout out to all the caregivers. You guys are the real MVPs.
Yeah, they're the real MVPs. Thank you so much for everyone that is taking care of someone with chronic illness. And I think one major thing that Dr. Shola has said, and it rings across the presentation, is support. For mental health issues, you need support. You need the counseling. You need the wherever you want to get support from, be it family, be it friends. The support is the key to ensuring that you make a quick recovery, right? So I would like to, at this point, now ask the audience to ask certain questions. Because of time, we won't be able to take all questions. But Dr. Shola is a wonderful partner of Leadway Health. So I can assure you that if we are not able to pick your question in this particular session, you can always email to us at Leadway Health, and we'll definitely pass it across to him and give you a response. So I have some questions in the chat box. I will take one question from the chat box and then ask for live questions. One question says, please, can someone easily get anxiolytic drugs off the counter, especially for patients with constant panic, fear, and depression? Dr. Shola, what do you think of that question?
Run away from anxiolytic drug as far as you can.
Yes.
Run away from it. Number one, because they have high dependent characteristics. And for people who don't know what anxiety, you're talking about your diazepam, the lorazepam, and all those palms. They are very, very addictive. The more you take them, the more your threshold will be high. So if you're taking 2 milligrams before, you take it for some time, then next month you will need 4 milligrams. Then you won't be able to do anything. Then gradually people will be fixated and think, until I see diazepam, I cannot do anything. No. So that is not the first line. The first line is therapy. Try to understand how you got there, and if it is pain, try to look at other ways of managing pain, meditation and all this. all these things we're talking, mindfulness, look at alternative options. I am not a big fan of anxiolytics because of this dependence there. But however, if it is what is required, it has to be prescribed under the guidance of a medical doctor. It's not something, it should not be sold off the counter. It should not be, but I know Nigeria, people are desperate and we can get anything on, but you are doing yourself a lot of harm and you're not helping that individual if you are colluding with the urge or need for anxiolytics. So speak to a therapist first. If that needs to be, if that is the only thing, then speak to your HMO. They can organize a pain management review and will guide you appropriately.
Yeah, I intentionally picked that question because a lot of people do not give enough attention to what therapy does, right? And a lot of people just want to buy medications and let the problem get out of the way. For psychological issues, like Dr. Shola said, the first line of management usually is therapy. We usually start with therapy. Before we start adding medications, it's after, we've done some form of therapy and we feel like medications will support, right? So medication is not the mainstay of treatment. So we don't want you going to the counter to buy anxiolytics just to get rid of the problem. Like you said, they have addictive properties. You keep increasing and you become dependent on it. That's very, very important that we note. Another, I would like to now go to the audience to pick some participants that would like to speak with us. Okay, I'm going to Mr. Alada Edward. Apologies if I'm not pronouncing your name right. But can I have Mr. Alada Edward, please, for his question? Quickly, please.
Good afternoon.
Good afternoon, sir. Please go ahead.
Yeah, my name is Alada Edward. I'm from Imo State.
Thank you.
Yeah, I want to ask, please, what can easily cause high blood pressure?
Okay. So Mr. Alada, we would require that question is sent to us in a separate forum. We're currently talking about the psychological strain, chronic illness, right? So we'll definitely share more information on that with you, but we want to focus on questions that relate to this particular program. All right. So thank you so much, Mr. Edward. Ms. Onye. Ms. Onye, please thank you, sir. Can we have your question, please? Hello, madam. Yes,
yeah, can you hear me? Can you hear me?
Yes, we can hear you.
Okay, so my question, when you stop this other person, I'm thinking if maybe my question is also off. The reason why I'm actually trying to raise this question is because the doctor mentioned how to relay an information about probably some illnesses to some patients. And he cited an example using cancer. So I was talking about that, but I think maybe it's also off the topic.
Yes. So it's a bit
so I'll reserve it. However, the point I want to make, I think I still need to make that point is because he mentioned about not maybe knowing how and when to divulge information, especially when somebody is having some chronic problems and what have you. But also, I have also seen cases where the patient and his family is not even aware of what the issues were, and nobody knew how deadly the disease was, and eventually the person died. And it was actually at the point of death that the doctor opened up to say, oh, it was so illness. So I think that, yes, even if the information needs to be managed, the family members ought to know so that they will be able to actually understand how they are going to help the patient and what they need to do. Because sometimes doctors may not want to divulge the information, probably maybe because they don't want to put panic on the family.
Thank you so much, Ma. I can understand your grievances. But I'd just like to say one thing to that statement. In practice, it's not allowed for a doctor to share the information with the family without getting consent from the person that is involved. So there are some ethical issues around that particular situation. But again, that's not the focus of our presentation today. So, but we definitely encourage and we speak to doctors every time to ensure that how bad news is broken is taken care of, because that can really impact the mental health of the person. But what we're trying to understand here is somebody already has a psychological strain, or somebody might have a psychological strain. What do we do? Right? What are the steps that we can do? And that's one of the things that Dr. Shola has tried to talk about in the presentation, in terms of counseling, in terms of journaling, in terms of meditation. Right. So I'd like to give one last person an opportunity, and that would be Miss or Mrs. Please pardon me, Sonia Bajomo. If you have any question that relates to this particular conversation.
Hello, I'm the man. My name is Bajo. Okay, yeah.
Thank you.
I want to ask Dr. Olaolowo Kere, is corruption a chronic illness? That's my question. If it is yes, I believe that what is going on in this country is a chronic illness. Not to the citizen, at least, but there are some people, and I want to advise that if Leadway can speak to some people, probably in the health sector, let them give him a lecture on the way that, because if somebody, for me, I'm not a medical doctor, if somebody is having 1 billion in his account and is just how many years old? 65 years old. And my calculation is telling me that if you spend that 1 billion every month, every day, sir, 1 million, you cannot finish that money till when God will call you. So I want to know from Dr. Olowo Kere, if corruption or embezzling money or putting too much money in a bank account is a chronic illness. So that's my question. Thank you very much. Dr. Taiwo, please correct I saw Dr. Taiwi, please. I saw Dr. Taiwi. That's
yes.
what. So you are laughing. Everybody is laughing. It's not a laughing matter, because that is what is going on in this country now.
Yeah.
And I believe that majority of the audience in this country, in this presentation, is I know they are undergoing the same thing, because this country is not a country that we should be suffering in this present situation. Thank you.
Yes. Thank you so much, sir, for your question. And I feel like we all know the answer to that question already. It is a chronic illness. So it's even more than a chronic illness at this point. I would like to ask Dr. Shola to approach the question in this way, in terms of how do you think, because we can't really change anything about our current situation, like individually. So how do you think we that found ourselves in this situation, how do you think we can go about protecting our mental health in the in this terrible economic situation where people are just stealing and stuff like that, as even as caregivers, even as those that have chronic illnesses, even as those that need to keep on taking medication to support themselves? How do you think we can prevent psychological strain in our current economic situation?
Thank you very much. Very good question, Mr. Sonia. And I will address it, but I want to comment on what you said. So in my field of psychiatry, when we diagnose patients, we have criteria for diagnosis. So it's not that someone can sit down somewhere and look at this person and say, this is what you have, or this is what you have. There's a worldwide guideline. We call it ICD-10 or DSM-5. So ICD-11 now, actually, International Classification of Diseases. And in mental health, you now call it mental and behavioral disorders, right? Over the years, they keep adding things and things and things to this classification. As of today, they've not added corruption yet, number one. But but let me tell you what the things they've added recently. They've added addiction to games. They've added addiction to pornography, to say these are disorders. So maybe in the nearest future, they would think about, if you think that you can just keep amassing a lot of wealth without ability to use. Maybe it will get there, but as of today, it is not yet there. So, but from what I've said, you can deduce from yourself. But now, to bringing this a much more solution-focused conversation to say, we are governed by people who possibly are doing all these things. How do we cope? We have another chance in 4 years' time to choose as a country who we believe can rule us if we think the current administration are not doing the right. You have that choice, which is to vote people into power or not. But at the moment, we really do not have control. And it's unfortunate that I'm saying this, but this is what it is. You need to accept that some things are out of your control. So look inward and try to make the best out of life the way it is at this moment. Look at your options, look at the way whereby you can still continue to prioritize your mental well-being and not let all these stresses and all these uncertainties and insecurities and all these things get to you. It is so important that you prioritize and focus on your mental well-being. I know it's so easy for me to say, but very difficult to put in practice. But I pray for wisdom for everyone.
Thank you, sir. I think one major point that Dr. Shola has mentioned is prioritizing your mental well-being. Because if you don't prioritize your mental well-being, Nigeria will continue to be here till kingdom come, except something happens, which probably wouldn't happen, right? So we can't keep, as difficult as it seems, we can't keep focusing on the fact that the country is bad. At the end of the day, you kind of have to be selfish to see, how do I protect myself? How do I ensure that my space, my family protects our mental health, even in this economic situation? So if you cannot do something drastic in terms of change your environment or going somewhere that'll make it better for you, or anyhow you want to do it, wherever you are in that particular point in time, prioritize your mental health so that you can take care of yourself, right? So I would like Dr. Shola to help us assist us with one more thing before we bring this session to a close. Because we've now identified that there is a psychological strain in chronic illness. When you have chronic illness or you're managing chronic illness, it is definitely possible. Somebody has disabled my camera. I'm not sure what went wrong, but I'll keep talking so that we don't waste our time. It is very possible now to have psychological strain for chronic illnesses. So I want us to highlight key points in terms of what you can do, just to bring it to an easy way to understand for the audience. Key points that you can do in terms of managing psychological strain or preventing psychological strain, just like maybe like a few key points, sir.
Okay, thank you very much. I think the first thing is for you to acknowledge the reality of the situation and not be in denial, right? To say, this is the situation, how do I move on from there? So acknowledge that, validate your own feelings that, yes, you don't deserve this, but we know you don't deserve it, but this is where we are. So that is your first step in being able to cope with whatever difficulties in terms of psychological difficulties that comes with that. Number two, you need a good support structure around you. Long-term physical illness, the psychological strain, is not a journey one can walk alone. You need good friends, you need good family, you need a good support structures, your faith. And this is when this song comes to mind. Bad energy should stay away. Only positive energy should be around you. People who would support you and will be there for you through your journey. And number three, know that seeking for help is not a sign of weakness. It is not a sign for a weakness. Speak for help. And also, while seeking for help, have this at the back of your mind that seeking for psychological help does not immediately mean that they're about to add another medication, because compliance with medication is a big problem with people who suffer from long-term physical illnesses. Say, if I go and take to them now, they will add another medication. No, that is not always the first line. Therapy is the first line. And we are all, we need to, we're all under, yeah, and open and honest conversation with your HMO, they will be able to advise and support your recovery right from pre onto post-diagnosis, and ensuring that even despite the chronic condition, you are able to achieve your maximum potential.
Thank you so much, sir. That is a beautiful summary of everything that we've discussed here today. And we hope that is a major part of this conversation that you have been able to take from this seminar, that there is hope. Just because there's psychological strain does not mean that there is no hope, there's no solution. And that's why we have people like Dr. Shola in that field, supporting and helping our psychological health, right? So the PDF for this presentation will definitely be shared. It will be shared across to everybody, so you can always go back to read it. If you have any more questions, please, you would have to send it to us at Leadway Health. We will send it across to him, and then we'll get your response. Or connect you with a psychologist, as the case may be. One other thing that I know that Leadway offers is definitely the counseling session. It's part of your package. So if you feel like you're having any psychological strain, if you feel like you're going through anything, we partner with Dr. Shola, which is who is in charge of Growing Insights Limited, and they are one of our major partners in terms of mental health. So if you feel like you have any problems, any psychological strain, anything you want to talk about, please reach out to us and let us know, and we'll schedule you for a session immediately. So we're here to take care of you, we're here to help you. Without further ado, I would like to say thank you again once more to Dr. Shola for handling this session. It has been beautiful. And as a final closure to this program, I would also like to ask the audience to just put in the comment box something that you have picked from this presentation, something that you have learned in this presentation, something new that you didn't know before this seminar, because we want to be sure that we're making impact in your day-to-day activity. So maybe just quickly in the next 30 seconds, because I want to wrap this up so that we don't stay too much above time. So anything that you feel like you have learned today. Faith, family, friend, thank you. Learn to know yourself. That's very, very important. Maybe it's one of the last one. Asking for help is not a sign of weakness. That is very important. We really appreciate the fact that people have learned from this session. And at this juncture, I would like to say this session has been powered by Leadway Health in collaboration with Growing Insights Limited. Sleep is primary. Stay away from bad energy. Thank you so much. Learn to take your meditation seriously. In fact, I think this has been a very educative and impactful session. We appreciate your knowledge. Right. So without further ado, thank you once again to everyone that has come to this program. Thank you for your time. Thank you for staying past the 1 hour mark. We hope you have a lovely day. We hope you take charge of your mental health and have a fabulous day. Thank you so much. So we can all leave now. Thank you. Yes, the slide will be shared, Bridget. The slide will be shared.
Thank you, everyone. Thank you.
Thank you. Bye.
Thank you. Bye.